Hello friends, welcome back to another video tutorial from Shomu's Biology. And in this video I am going to talk about a very common disease which is misunderstood and which is less discussed about, but it is present almost a huge population right now, and that is IBS, Irritable Bowel Syndrome. Okay, many people are not comfortable talking about that, so they always tend to hide it, and as a result of which it's spreading along due to the huge amount of stress that we are in current situations. This disease is almost catching everybody. So stay tuned to learn more about IBS. We will be talking about what is IBS, IBS symptoms, IBS diagnosis and IBS treatment. Okay, so stay tuned and watch this video. So the very first thing is, what is IBS? Irritable bowel syndrome. As per the name suggests, this disease is related to the discomfort of abdomen. Okay, so if you look at this dummy that we have in this side, this is our small intestine, this is our large intestine. This problem with IBS always comes with the large intestine, particularly some part of the small intestine, but mostly of the large intestine. Now normally when we eat food, after eating the food, food gets digested here in the, let me put it aside. Food gets digested in the stomach, some portion digested in the mouth, some portion digested in the stomach, and then rest of the portions are digested in the small intestine. And finally everything is done, the digestion is complete. Then the water reabsorption takes place in the small intestine, and also finally the reabsorption of water can be done in the large intestine. So large intestine is a place where at the end of the digestion process, the components which are not required for the body should be placed, compacted, form the stool and come out from our body. And this is a very important process, and we all know how important it is. If this process gets halted, then our other issues, for example, hunger and all the other things, will also be shut down by the body itself. So in IBS, what happens actually? In IBS or irritable bowel syndrome, when the stool components present in the large intestine, it's going to irritate the large intestine. Okay, as a result of this irritation, there is the abdominal discomfort, there is the abdominal pain, cramping, and that leads to either constipation or severe constipation, or that may result in diarrhea or severe diarrhea. So this what happens with the IBS. A patient of IBS will complain with diarrheal tendencies or constipation tendencies for a stretch of time, stretch of a week or 2 weeks. They have a stretch of diarrhea, they have a stretch of constipation, like that. Okay, so they will not even understand what goes wrong, because when people have diarrhea, they always think there's some sort of infection, right? What we think, if there's a diarrhea, some sort of infection, right? Or when we see there is a constipation, that may be for the other underlying causes is there. You are not drinking plenty of water, you are not taking fibers enough, that may lead to the constipation. But constipation and diarrhea, they have several different causes, but this is one of the predominant cause. And the bigger disadvantage with IBS is that it's not only causing the diarrhea or constipation, but it's very difficult to get rid of. That's what make IBS really irritable. Now the question you can ask is that in IBS, I said that when the component after digestion, the stool components, when it's present in the large intestine, it irritates the large intestine. Now why would our own body material will irritate us? It should not. Okay, for those who are of normal human being without IBS, in normal situation it never irritates. But in IBS patients, what happens is that this stool component that is present in the large intestine irritates us. Why it irritates? There is no proper answer to that. That is the biggest problem. There is no proper answer. What we found out is that our whole digestive system, a lot of this digestive system, including the small intestine, large intestine, under the regulation of our brain, okay, of our master structure, our brain. Okay, so what happens here is that this brain is always suggesting our body of what to do, what not to do, depending upon the situation we are in. For example, if you are hungry, you will eat a lot much, right? So in order to be hungry, you need to get rid of all the components that you have in the large intestine. That is kind of a idea. So if a person is not passing the stool for 3, 4, 5 days, the hunger will also fade off. And this is quite logical, right? So everything is under the control of brain. So brain regulates all this process. There are nerves coming from the brain, and these nerves are present connecting the brain with the large intestine, with small intestine, with stomach, in every different presence. And what happens here is that when the stool reaches the large intestine, normally there is a proper signaling from this large intestine to the brain that large intestine is filled with stool, so they need to get rid of this. So the nerves signal the large intestine to initiate a process known as peristalsis. The peristalsis is present from the stomach till the large intestine. It's always present. Peristalsis is a sequential movement of muscles, and those movement of muscle will help to push the food, undigested food, undigested food, digested food, and as well as the excretory content of the food. Everything need to be following the same pattern of peristalsis, and as a result of the peristalsis, it's creating a pressure. For example, it's creating pressure from this side, so it will push the stool to the right side, like that. So this process will continue until and unless it is getting rid of the body, right? But what happens here is that there is some sort of problem, some sort of defect in terms of the signaling between the brain and the large intestine, and as a result of this interaction between the brain and large intestine, there is no proper communication, and due to the communication gap between our large intestine and our brain, it is causing so much confusion for our body, as a result of which the excretory content, the stool that needs to be out of the body, staying there, as a result of which it irritates the tissues surrounding them. As a result, constipation builds up. Now what is constipation? When the stool is produced but it's not coming out of the body. So that's what happens, because they are not receiving the signal of peristalsis. The peristalsis is halted, slowed down. As a result, the stool is not being passed. Okay, that is one problem that is causing the constipation. On the other hand, the other thing can also be caused. So the brain is hyperactivated and continuously sending signal to the large intestine to have peristalsis. So now what will happen? The person with this kind of situation will have increased peristalsis. Increased peristalsis means increased movement of the components, increased movement of the food that is present in the stomach, from stomach to the small intestine, from small intestine to the large intestine. So what will happen often, that the food will not be properly digested, because the peristalsis is so fast, the time is not provided for the food to be digested. So a lot of materials, even before the proper digestion, will come to the large intestine, and as a result of higher peristalsis rate, the compaction of the stool will not be done, as a result of which diarrhea will be caused, and severe diarrhea will be caused. So these are the two situations. Either the patient will complain constipation, severe constipation, or they will complain about diarrhea or severe diarrhea or continuous diarrhea. And when you taste their stool for both, you will not find any infective agent, you will not find any bacterial infection, you will not find any protozoal infection, any parasitic infection will not be found there. So that makes us think that something else is linked with it. Okay, so that is the idea regarding IBS, irritable bowel syndrome. Now there is another term you may heard, IBD, inflammatory bowel disease. That's a totally separate thing. Okay, many people may say IBD, IBS almost in the synonymous way, but they are lot different. IBD is a structural problem of the body. In IBD or inflammatory bowel disease, the term inflammatory or inflammation means swelling up. So our intestine, large and small intestine, they start swelling up, and as a result of which it causes problem in terms of movement of the food component and stool throughout the body. That is a separate thing. Although the same thing is associated, that is like problem with constipation and diarrhea also associated with IBD. But along with that, in IBD you will also see blood secretion from the small intestine or large intestine, even in the upper GI tract. As a result, it may be more dangerous. Okay, and IBD is not that common, but IBS is very common. Many people may have this. You can test yourself whether you have IBS or not, but many people have this, but they don't understand what is the underlying cause of IBS. So the symptoms of IBS I have already talked about. The symptom is 1, prolonged diarrhea, diarrheal tendencies, then normal, then again diarrheal tendencies, or prolonged constipation tendencies for 6, 7, 8 days, then again some sort of break, and then another stretch of constipation tendencies, or there can be repeated like diarrheal tendencies for 3-4 days, then constipation for 6-7 days. So that cycle continues. In the very first case where there is a prolonged diarrheal tendencies, we call it IBS-D or IBS diarrhea specific, and if it is constipation predominant IBS, we call it IBS-C or IBS constipation. Okay, and there can be IBS-CD. So in that case, there will be a stretch of diarrhea, then there is a stretch of constipation. So in those patients, it will be very irritating thing for their whole life, because they have a stretch of diarrhea, they have a stretch of, then right after that stretch of constipation. It will be very difficult to manage your own life, although it's not life threatening, but it will definitely irritate you and it will definitely impact your social life. Now, what is the diagnosis of IBS? Now, this is a really critical and crucial part. The diagnosis, as this disease IBS, they do not have any sort of structural deformity in the body. It's very hard to identify. Normally we can identify those diseases first which has either a visual clue or a response or a structural modifications or alteration, which we can detect with different techniques. But in this case of an IBS patient, always remember this, in an IBS patient, if you check their USG, you will find a normal USG profile. Second thing, you will check their stool, normal stool profile. The third thing, you will go through the colonoscopy, normal colonoscopy. So if a person's colonoscopy is normal, if a person's stool is absolutely normal, if a person's USG, ultrasonography of the lower abdomen is perfectly normal, or a whole pelvis perfectly normal, in that case, still even after all these normal things, blood tests are normal, after all these 4 tests, if the person is still complaining about a stretch of diarrhea or stretch of constipation or a repeated unit of diarrhea and constipation, then doctors always tell that this is IBS. So IBS is not a disease which can be identified from a bunch of 20 or 80 diseases. IBS is diagnosed based on exclusion principle. What is exclusion principle? Exclusion principle means doctors start to think of other diseases, and when all the tests are done and no other diseases are found, so all the other diseases are excluded, then the only option left is IBS. So if nothing is present, no other diseases are present, still you are facing abdominal discomfort, still you are facing constipation, still you are facing diarrhea, then they mark it as an IBS. So IBS diagnosis takes time, and there are plenty of diagnostic tests you need to go through in order to identify that you have IBS. But it's very important that you have done all the tests in a stretch and proper way, so that you get to know about your IBS situation. Otherwise people may misdiagnose it. There may be something else, there may be something other underlying illness present, right, in your gastrointestinal section, that may cause the similar effects, because all the gastrointestinal issues somehow related to constipation or diarrhea or tarry black colored stool or things like that. So you need to get rid of all the other options first, then only you can mark that yes, this disease is IBS. Okay, that are the symptoms of IBS. Okay. The final thing is regarding the treatment. So what is the treatment of IBS? In very simple word, there is no treatment for IBS. There is no cure for IBS right now. Not treatment, but there is no cure for IBS right now in our hand. Okay, it's an incurable disease. Okay, so if you have IBS, congratulations, you are now an elite group of incurable disease. So in this case, you can only manage the disease, but you cannot get it cured properly, because as we know very little about how the disease is actually formed in the very first place. But what I can tell is that there is a huge role of your brain in regulating your bowel. So if your brain is somehow stressed, then it will always trigger IBS. And in IBS, the most important factor that triggers IBS is your stress, nothing else. There will be some food which will trigger IBS. For example, coffee for some cases, some citrus fruit juices, for example, tea for some people, paprika for some people, so spices for some people. So all these things, more spice or this sort of components can trigger IBS, but the maximum triggering agent is the stress. So if you have IBS, do not take excessive stress. Try to reduce your stress, and if you reduce your stress, you will itself see the benefit. Because what happens with IBS patient is that when a patient has IBS, they know that their whole life social life is completely in a jeopardy, because they think like always there is either a constipated tendency or a diarrheal tendency. It's very difficult. You need to either go to the bathroom 4, 5, 6 times a day, or you are not going to the bathroom almost 5, 6 weeks. So I mean 5, 6 days in a stretch, 3, 4 days in a stretch, and then you are going once, and the stool is really hard, that is creating pain and all these things. So it is completely shattering the confidence of many people. As a result of which they continue to think of this disease, as a result of which more stress, as a result the disease is even staying for long. So to get rid of this disease, you need to reduce the stress factor. This is the very first thing that you need to do. Second thing is the lifestyle adjustments. You need to wear not very tight clothes, clothes without, like, if you are wearing pants, that it should not be very much tight in that area, in your pelvis area. That's one thing. The second thing is that the lifestyle adjustment means regular exercise is very, very important. You need to do regular exercise, and along with regular exercise, some sort of walk and all, it's very, very important in order to have a proper healthy digestive system and a healthy peristalsis, proper regulated peristalsis in your body. Third thing is sleep. You need to have a proper time of sleep, proper time of eating, proper time of all the different habits. Timing is very, very important. You're eating enough, and you're eating at a proper time all the day, every single day, and you're also sleeping at the same time every single day. This is also very, very important. So, if I say all these things, medicine is a separate thing, but medicine will only make it better for some days. When you have a stretch of diarrheal tendencies or constipation tendency, you can take the medicine and this situation will be better within a week. After that week, if you want to get rid of this for years to come, then you need to adjust your lifestyle, because this is a disease of a modern lifestyle. People earlier lifestyle will not have this disease. They did not have the disease. Right now the people have this disease, and in future this disease will even increase in the people. Okay, so maintain all these three things. And the fourth an important thing is that for a better digestive health, we need to eat a lot of green vegetables and more fiber rich diet. Fiber rich diet will always help proper digestion. But if you have diarrhea predominant IBS, in that case fiber uptake must be reduced, and in that case obviously you need to take some probiotics. Okay, probiotics means bacteria which is present in our large intestine, and they help the compaction of the stool, as well as they help in production of some vitamins, and also help in our body in several different ways, builds our immunity, and it helps in a several different way in terms of protecting us against different invading bacteria or pathogens. So if normally it is found out that people with the diarrheal tendency IBS, they have a disturbed microflora of their large intestine. So what we need to do, we need to treat them with antibiotics. So antibiotics will kill any unwanted microorganism that is present in your large intestine, and then we need to supply them with probiotics, which is a fresh, better bacteria. Generally the bacteria are Lactobacillus acidophilus or Saccharomyces species are there, and Saccharomyces boulardii, for example, and there is other things like Bifidobacterium. So Bifidobacterium, Lactobacillus acidophilus, Saccharomyces boulardii, these are the different important bacteria that can fight against the other pathogens and make and feel us better during the IBS diarrheal tendencies. So that's what happens here. Okay, so these are the different treatment methods. Okay, if you have diarrheal tendencies, then generally the antibiotic is given. Diarrhea and constipation, both tendencies, antibiotics are given, with that probiotics are given. This is a very common thing. And apart from that, if you have diarrheal tendencies, some other medications are given to prevent the diarrhea, stop the diarrhea, and make the bowel habits normal. And if it's a constipation tendencies, then more and more fiber intake is needed. There are different medicines that can cause the stool context to be less hard, so that is provided in order to prevent. Okay, so in order to prevent the constipation, these things are provided, and that will give you simple systemic, like a relief for the 1 or 2 weeks. Generally the antibiotic treatment lasts for 2 weeks maximum. After that you may feel good for 1 or 2 more weeks, but after that it may again come, until and unless you adjust and you keep track of all the foods that you are eating, you keep track of all the things that triggers IBS, particularly the mental stress. You need to get rid of the stress as soon as possible in order to control IBS. Okay, so that's the different way to control IBS. That is the underlying treatment right now. Okay, so if you have IBS, if you are diagnosed with IBS, follow these treatment procedures. I found out that in many cases eating curd throughout months, because the curd is a thing, it's not a medicine, but it's delicious. You can eat it. You can eat it whole year long. So if you can eat it whole year long, if you are not lactose intolerant, then obviously you can eat it whole year long. And if you can eat it whole year long, you'll find out that this curd will be really beneficial, because the curd contains a lot of beneficial microflora, bacteria in it. Okay, so it will give you overall support, because it's kind of not possible to eat to take medicines throughout of the lifespan, but curd can help you because it's a food, right? So keep this thing in your mind, and I hope this will definitely benefit. And if you are facing this problem with constipation and diarrheal tendencies and not being diagnosed with IBS yet, then I'll tell you to have a proper diagnosis. Go to a gastrointestinal MD, talk to them regarding your problem, and go through all the different tests, finally diagnose for the IBS. Okay, so that's it for the video. If you like this video, please hit the like button, share this video with your friend, subscribe to this channel to get more and more video in future. Thank you.